things began to go south. Dr. Fehring saw me at the end of the day and said, when did you have your last blood thinner? We're supposed to wait 5 days to have surgery. You can't wait that long.
I met Bob Mahosky about 5 or 6 years ago. He had a complication following a relatively routine knee replacement. He became infected. His surgeon had offered him an amputation or a visit to the OrthoCarolina Hip and Knee Center. And I thought I could salvage his knee replacement.
Many of these patients with these periprosthetic joint infections have had several surgeries or been told by their outside physician there's nothing more they can do. These patients are typically referred to us as sort of their last option in terms of salvaging the knee and getting a good outcome.
Most bacteria that are associated with joint infections exist naturally within the body. The reason that we see these joint infections is those bacteria go from the bloodstream and end up growing onto the implant surface itself.
They're going to go in now and take out the insert, and what's my leg going to be like? Am I going to lose the leg, or am I going to have one that's an articulating leg? And Dr. Fehring said to me, if you will just trust me, I'll do the best I can for you. And I didn't really have a choice, did I? That's the reality of it. So, came out of there with a leg that bends. Not a stiff leg, not a missing leg, one that bends. And here I am many years later now. This is 2021, and still walking, still doing well. Like I said, I'm so blessed to have had Dr. Fehring, Dr. Otero, the whole group, all the work they did, and the hospital and the way it helped me.
Periprosthetic joint infections are rare in total joint replacement, with less than 1% of patients who undergo a total knee or a total hip replacement coming down with an infection. However, those patients that do end up getting an infection, it's a very difficult problem.
I had the idea that we need surgeons who do this every day, and this way the patient will get better care. If just an orthopedist treats 1 or 2 of these infection cases a year, they're not going to be as experienced as someone who does it a couple times a week. We've seen 300 patients since we started this just a little over a year ago. We'll be able to develop protocols and research projects that will answer the questions that have been unanswered my whole career.
We're actually using a technique called a single-stage exchange, where we basically are doing 2 operations in one sitting in one day. So we take the implants out, we clean the joint thoroughly, and then put a knee or hip replacement that's brand new back in the patient. This is a big win for the patients because they only have to go through 1 operation.
A big part of our focus is not just treating patients once they develop periprosthetic joint infection, and that's a big part of what our center is, but also developing protocols and algorithms to try and prevent periprosthetic joint infection from developing in the first place.
We have 5 members of our team with more than 50 years of combined experience taking care of periprosthetic joint infection, and so we really feel that we've developed best practices, and it's our goal to lead the charge in the nation to describe pathways to help these patients clear their infections. And what we're trying to do right now is establish a model that can be replicated regionally.
I was challenged by one of my patients who went through a 2-stage reimplantation. He said, "You know what you guys need?" He said, "I had a heart attack about 4 years ago, and someone from the Mending Hearts came by and visited me in the hospital and guided me through the process of my cardiac rehabilitation." He says, "You need something like that in joint replacement." So that stimulated me to start a website called healingjoints.org. We give tips to patients who are going through this, what to expect, what kind of challenges they're going to face in their postoperative, and this gives some resources for the caregivers to help the patient get the optimal result.
I can tell you from so many of these patients that we have referred into us every day and every week, how thankful they are to be able to be at a place and be able to be at a center that has the resources to help them get better. It's great to see those patients come back, you know, at 3 months, at 6 months, and a year, because they've been fighting this infection oftentimes for months or years, and it's been devastating to them physically, mentally, emotionally, and to see them on the other side of a successful treatment is really, really rewarding.
What an amazing opportunity to change the way orthopedic surgery approaches that problem and specializes on people like me. I'm so blessed to have had Dr. Fehring, Dr. Otero, the whole group, all the work they did.